All right, we are here with Morgan Campbell, Laura Packard, and Catherine CVA. They are answering your questions about health care, enrollment, and Medicare. Laura, this person's asking, can I qualify for marketplace insurance if I have money in my savings account?
Yes, you can. I think maybe they're asking about income levels, which would determine whether they can get an ACA plan and the amount of credits that they would get. But if you have money in the bank, that has no effect on whether you can get insurance through the Affordable Care Act.
Okay, this next question is, my husband will be 65 in January. That's when he needs to sign up for Medicare. And I will be 64 in 2022. What do we need to do with our healthcare.gov? Am I the only one signing up, or are we both signing up?
He is going to be the only one signing up. She's simply going to log into her healthcare.gov account. She's going to click report a life change, and she's going to remove her husband off of the application. She's still going to have him listed as income and as a member of the household to make sure that they do not get into a tax issue. Very, very important there.
Okay, so that may be one of those things where you want to talk to one of those health insurers like Morgan, who they don't take any money from you. They get paid from the insurance companies. So they might be able to help you kind of figure out what's going on with that. Catherine, this person is asking, if you already had Medicare disability and the Advantage plan, do you have to sign up again at the age of 65?
No, you do not.
Okay. So this person says, where do you go if you need to sit down and talk with someone about signing up for Medicare? I'm sure Catherine and Morgan both have thoughts on that.
Well, there's a number of different ways. Morgan is certainly, and an insurance agent are certainly available to do that. If you need some information and you want to go on the web, the SHIP program from the North Carolina Department of Health is a great program. It's SH2I's IIP. That's a great website to look at. And then AARP.org, Medicare has a lot of information too.
All right, Morgan, this person says, I'm 74 on Medicare, supplemental F. I've got diabetes. Can I change to G because it costs less?
You absolutely can change to G. Plan F has been retired. That's kind of like a gym. If you have it, I would be hesitant to let it go unless it was just strictly based off of financial reasons.
Okay. So this person's saying, will my 401k retirement plan and savings account keep me from qualifying for Medicaid?
Yes.
Likely.
So, but not with Medicare. That's a totally different thing. Medicaid is something totally different from Medicare. Okay. This person says, my spouse will turn 65 this December. She is not employed, and she's fully covered under my employer's health care coverage. Is it Part A or Part B she signs up for, and is my employer's coverage considered to be primary?
Well, she definitely has to sign up, and she has to sign up for Part A. Whether or not she signs up for Part B is something that you need to look at with your HR department, whether she continues to be eligible through their employment, their insurance, and whether or not it makes sense for her considering what the benefits are.
All right, this person says, what happens if you're on disability and you're turning 65 in 3 months?
Nothing. Unless you're have not ever had any Medicare. If you're disabled and getting your funds from somewhere else, you need to make sure you still sign up for Medicare.
Okay. So Morgan, this person says my retirement age is 66 and a half. Do I still need to sign up 3 months before my 65th birthday?
Yes.
Yes, you do. It's that 7-month window, right?
Yes.
Okay. And then this person says, when you turn 50, can you qualify for Medicaid or any kind of assistance while working? And I don't think anybody here that's in their wheelhouse, right? Because we're talking about ACA and Marketplace. Laura, did you have a thought?
Oh, sure. Just Medicaid is based on income levels, and especially in North Carolina that didn't expand Medicaid, it's not very available. You need to have specific conditions and make very low amounts of money, and many people are just not eligible at all. So you would have to look into that, but probably you're not going to be eligible.
Okay.
And the 50 age doesn't really make a difference in that. It's really income based.
Income based, not age based. This person says, I'm already enrolled in healthcare.gov. Can I enroll again or change for a lower premium?
Yes. Yes, you can.
Yes, and if you need help figuring out what's going on, an insurance agent will be able to kind of go through some of those things for you and help you try to, unweave all of that. Thank you for your time and your expertise. We appreciate it. If you missed anything, we want you to be able to go to the Two Wants to Know section.